Dr. James Machino, and welcome to Lesson 1, which is Getting Started, How to Package and Charge for Nutrition and Lifestyle Medicine Consulting. So let's get started with this discussion. It's an important one. So there's really three main aspects to nutritional consulting from a billing and delivery of services standpoint. The first thing is that there's an initial consultation and examination, which you bill for. And then there's standard follow-up visits. Once you've seen a patient, you're going to then follow their progress over time. We'll talk about that. And then in certain situations, it's highly advisable to actually sell a program to the patient, especially if they need to lose weight. But you can also do the same thing with type 2 diabetes management, a cardiovascular program, even an osteoporosis program, if you have the right equipment in place. So let's address this. But to really appreciate what this all means to your bottom line, you say, well, how much money would I be charging for these different services that I'm offering? How much extra money can I really make? And the truth is that, if you just dabble in this, you could probably make $25,000 a year, maybe $50,000 a year. If you get more aggressive, you could probably be making more than $100,000 a year from doing nutrition and lifestyle counseling. So how does that all add up? Well, the initial assessment itself it takes about 60 to 90 minutes to do. And I'm charging at this point $275 to $350 for that initial assessment, depending on the complexity of it. And so you say, what happens during the initial examination consultation? Well, you're doing a review of their intake forms and looking at the key data. So you're assembling all the pieces together. You're doing a proper sort of case history. But then you want to look at their dietary practices and their exercise routine if they have one. So these are intake forms that you need to have in place. You're looking at comorbidity issues. What are the other health issues that they have that maybe you need to address as part of your overall management in terms of nutritional medicine and lifestyle coaching? And what's their health history? What's their family health history been? And what medications are they on presently? And what are those medications doing to their body? What are the contraindications to those medications? What dietary supplements are they taking presently? What surgeries have they had? What allergies do they have, including what food allergies? And then, if possible, and it's highly advisable to get some lab results available. We'll talk about how you do all this. And from the lab findings, you're seeing objective measurements of key things like glucose and cholesterol, possibly homocysteine inflammatory markers, serum ferritin, a series of biomarkers that are really important to track over time to see if the person's making progress, including inflammatory markers for people that have more inflammatory conditions. Then you're doing a physical exam and an anthropometric exam to look at their body mass index and waist circumference and all these things that are initial baseline measurements. And then once that's all done, you're providing them with recommendations. You're doing this consultation where you're saying, here are the dietary recommendations or modifications I want you to make based on what you're doing presently. These are modifications that would make the most sense for you. And this is the exact exercise protocol that you should be following. How many reps, how many sets, what the cardio time should be, what your heart rate should be. And then what supplements are you recommending? What dosages, standardized grade of certain herbals, or whatever types of supplements make sense for them based on evidence-based assessment. And then are there other diet lifestyle factors that could be playing a significant role that you want to talk to them about, whether it's meditation or progressive relaxation or some kind of biofeedback? And what goals do you have for them? If you looked at the blood work and you're looking at their glucose or their hemoglobin A1C or their LDL cholesterol, what goals are you setting for them to achieve using your lifestyle interventions? You want to set those goals. It's same with their body weight and their waist circumference and other health parameters that are key objective measurements. So that's the initial consultation and exam. And that takes 60 to 90 minutes to do a good job of that. So you're charging right now, I'm ballparking that $275 to $350 for an initial consult. And then the follow-up visits, that might be scheduled every 3 months. I mean, it's not like you have to see the person over and over again. They have to have time to let these changes have an effect. But then you're reviewing their compliance. You're looking at changes to their lab work. You're giving them feedback on how they're doing. You're making adjustments to their program based upon the results you're getting. The follow-up visit takes only about 10 to 20 minutes. But, you're charging for this type of follow-up, something in the neighborhood of about $75 to $125, depending on the complexity. But if you build up a clientele of these patients, where you have, say, 50 that are in the follow-up mode, and you're seeing them, every 3 months roughly, that adds about another $20,000 to your overall bottom line at the end of the year. And in certain cases, you're also selling programs. So the person who needs to lose weight and really needs that help and they can't do it on their own, rather than selling them, a one-off type of assessment and recommendation, you put them into a weight management program. Let's say it's 12 weeks long. You're charging them somewhere in the range of $1,000 for that 3-month program. And now you're going to be seeing them each week to really hold their hand to the fire and make sure that they get it done. So that's a program that you're selling. It's not just a consultation. And then if there's exercise equipment available, you can put people into an osteoporosis strengthening program for bone density or cardiovascular risk factor management using cardio equipment, getting their body weight down, as well as the nutrition counseling. And same with type 2 diabetes. A lot of these patients are overweight. They're not in very good shape. They need a place to do supervised exercise. So you're selling them, a 12-week program, usually in the range of $1,000, to try to get the risk factors more manageable. Get that glucose down, the hemoglobin A1C down, get their blood pressure down, get their cholesterol down, get their triglycerides down. This requires dietary intervention and keeping track of people on a weekly basis to make sure they really do, but also having them exercise on a regular basis. And if you have the equipment, then you can do it right in your own facility. And then once the initial program's over at the end of the 12 weeks, these people still need some kind of weekly or monthly follow-up depending upon the success they're having. The truth is that these individuals who are overweight, or they've got cardiovascular risk factors, that they're type 2 diabetics, or even people with, bone density issues, often they need someone to hold their hand for a period of time till it becomes a natural extension of their life, where they're actually doing what's right and what's in their best interest, and from a lifestyle medicine standpoint, till it becomes just an automatic thing that they do and they can be left to their own devices. So these people are happy to be put into a program if you can actually deliver the end result that's important. So the question then is, how much money can you make from doing a combination of these things? So the reality is that you could easily get to $100,000 a year just simply by providing one new patient, one weight loss patient a week. And then in conjunction with that, if you're just doing 3 to 4 new patient assessments a week, just tallying that up alone gives you $100,000 of income a year. And that's with zero follow-up visits, which is a very unrealistic. All of these patients need follow-up to some degree. So, and remember that the requirement to do this kind of coaching really just requires your own intellectual property. For the most part, you're sitting across from a desk just having a conversation with people, looking at their medical history, intake forms, looking at their lab results, giving them advice and explaining how nutrition and lifestyle medicine impacts their health status right now and what they can be doing to reverse it. So it's not physically demanding the way other types of clinical applications would be. So you have to remember that with nutritional consulting, it's very fast becoming an important part of many health practices, different types of practices. And during your winding down years, as you head towards retirement, it can give you an ability to generate income just from your own intellectual property, from your lifetime experience with patients, coupled with your expertise in nutritional medicine and patient follow-up. You can continue to generate a significant amount of income without having to work that hard physically, because your body will break down over time. Your energy level will wane to some degree. So the question is, what's your backup plan to keep income coming through the door with the least amount of physical demand on your body? So this gives you this sort of ability to generate income without those physical demands and still provide a high level of clinical service. So the question is, how nice would it be to still be making $50,000 to $100,000 a year, just working part-time, providing patient consultations? And we haven't even talked about how to generate income from lecturing on nutrition topics. What you want to know is that out in the corporate world, corporations and human resource people are very hungry to have experts come in that can speak about nutrition-related topics to their employees and their plan members. It's a very hot topic. So corporate wellness is now mandated, and nutrition is a very important topic for employees to understand because companies know that if people eat healthier and they employ a more aggressive and proactive lifestyle things to keep themselves fit and to keep their risk factors low, that there's less absenteeism, less disability, there's fewer drug costs. This is good for the company, but it also leads to better productivity and better quality of life for the actual employee themselves. So it's a win-win. And nutrition is a very hot topic. They need people that have this expertise, who have the kinds of nutritional consulting credentials behind their name that can actually provide this. So if you just did, a little bit of outreach, you'd find that in terms of doing corporate seminars and some professional seminars, you can probably earn another $5,000 to $10,000 a year or more just doing lectures and lunch and learns and this type of sort of corporate type of engagement. So I hope you're starting to get motivated by all this. So in lesson two, which will be the next lesson, we'll talk about implementation. I'm going to explain how to introduce and promote nutritional consulting to your patients, to your community, to local physicians, to other colleagues, and other important stakeholders that have an interest in seeing people get this kind of help. And you sort of how to generate referrals from all of these sources. So stay tuned, and I will see you in lesson two.